Good morning, everybody, and welcome to the vlog. I'm really glad you're here with us today. We are heading to the doctor for Sunshine's follow-up from her MRI. So we are going to get the MRI results from the doctor today. I'm feeling very anxious of what he's going to say, but also really excited because whatever's going on with her, we want to take action and start getting her better. Sunshine, how are you feeling?
I'm feeling really scared if we have to get surgery or something, and I'm feeling really excited if it's not surgery. I'm going to be so grateful. So hopefully it's not surgery, but I'm very excited to find out what is going on with my knee. You have to be broken.
So you're excited that the mystery is going to be solved?
Yes.
But you're also scared
it might be surgery.
That it might be surgery.
Yes.
Yeah, that is understandable. How has your knee been feeling?
It's been hurting a lot.
Can you walk?
Nope. Mommy, my crutches!
You left your crutches?
Oh my gosh, yes.
Seriously?
Yes.
Okay, well, we're going to have to get them all the way back to school because you're going to be late to your appointment, but you're around now.
So I'm going to be hopping?
Yeah.
How did I forget my crutches?
Let's do that on film.
No, it is filming. It was filming.
The results could be anything. I mean, when the doctor was mentioning possibilities, it literally ran the gamut of all kinds of illnesses and injuries. You know, it could be broken, it could be a tear in a tendon, it could be cancer, it could be anything. And so, you know, that is so wide open, I can't even be concerned of the what. So right now, really, all that matters in my mind is there are, you know, 3 possibilities of treatment at this point. And one is she needs more time on the crutches, which would be fine, and probably her armpits would not like that, but you know, that's easy, we can do that. One would be surgery, which would be a really big deal and makes me very nervous for her. And 3 would be physical therapy, you know, meaning that there really isn't an injury left anymore and she needs to learn to use the leg again. So, you know, we can do all of those things. We just need to know what's going to make her better. So come along, let's go see the doctor. That looks ridiculous.
Daddy's coming.
You ready to see the doctor?
Yes.
How you feeling?
Scared.
How you feeling, Dad?
So I hope she doesn't have to have surgery.
Oh, I didn't know you were doing me. You were really taking them. I was like, okay. My leg. I know this place like the back of my hand.
You were very fast.
I know this place.
You know this place like the back of your hand? You've been here 3 times and you know it?
Yeah.
Good morning.
How you doing?
Good, how are you?
What's up, to? Got your big camera today.
Yep. Forgot it.
How you been? How's your knee doing?
It still hurts.
You getting any better?
No, I don't think so.
Not better?
Not better at all?
No, I don't think so.
What do y'all think?
She's still not putting any weight on it.
I'm strange. Her MRI looks great. Her MRI looks fine. She's got a little fluid in the knee, suggestive of some inflammation, but growth plates look fine, cartilage looks fine, meniscus looks fine. There's no evidence of a growth plate fracture. That's what we kind of talked about.
Yes.
Is there something that the x-rays are just missing? And tell me how you hurt yourself again.
I heard a pop in my knee when I was running
Yeah.
PE.
All right. So, you know, on her MRI, she's got fluid behind the kneecap in the front of the knee.
Okay.
There's no evidence of, to me, her kneecap probably popped in, popped out. Okay, but the ligaments don't look torn, which is a great thing.
Good.
Your ligaments look a little bit loose on your MRI. The way your knee sits when she lays down, it's kind of sagging, and it can just be due to loose joints. So do this with your arm for me. Let me just check your elbows here. know, she's at that age where her knees are knock-kneed. You go bow-legged when you're a little baby.
Okay.
And then you go knock-kneed, peaks it around with 10, and then you go straight. And the force of the kneecap when you bend, when you're L-shaped, is it wants to go to the outside.
Okay.
More likely than not, it went subluxed and came back in, kind of in and out of this groove. Let me show you on a model.
You still scared?
So you know surgery for you, okay?
Yeah.
So your kneecap rides in this groove right here, like that, right? And your tissues that hold your kneecap in place are a little bit loose. And then your leg's also L-shaped a little bit. So the combination of the two makes your kneecap want to kind of move around a little bit more than normal. And I think what happened is your kneecap probably popped in and popped out, but it didn't tear the ligament, the tissue that holds it in place forever. And so I don't think you're going to need an operation. I think we should do some therapy with her if she's not better by now.
Yeah.
And really get her strengthened in her quad, get her on a program to kind of straighten that out.
Okay.
Yeah, so she's really tight. She's been keeping this thing bent the whole time. Yeah, and you can see how weak, how if you look at her legs, I mean, this quad is becoming real soft because she's not using it too much. I think we should get you into some therapy, get some people working with you to get you moving this thing. Let me just check. Does that hurt? It doesn't hurt at all. Okay, perfect. Good. Just checking your hip. That hurt? Does it feel good? Yeah, she's stretching already. At first it was real tight.
Mm-hmm. That used to hurt. It doesn't hurt now?
A little bit.
Yeah.
Like a good hurt? Like a stretch?
Yeah, so she's real tight. She's like, I don't know if it's a good hurt or a bad. But she's already straight, so. I think you're gonna be okay. I'm gonna sing you to someone that is gonna work with you on moving your legs, strengthening them. They're gonna give you homework though. And so you gotta do the homework. They're not gonna fix you, you're gonna fix you. So when they give you exercise to do at home, you're gonna have to do them. Does that sound okay?
Can you do homework? Yes.
Yeah, you're
She's
good at it.
She's good at homework.
Okay.
Yeah.
All right.
Awesome. Well, that's
Any
great news.
questions?
Thank you.
What do you want her to do in the meantime?
I would ace wrap it. I would, you know, what I just did in straightening it, if you'll let them help you work on straightening this, I'm going to give you a handout of the exercises that I give people that have this issue. And it's just movement exercises. The more you move your knee, the quicker this is going to get better. So you can sit on the floor or your bed and kind of work on straightening it. Scoot back this way. Okay. There you go. Slide your heel back out further. Feel that stretch back here? Yes, we need to work on getting this thing straight and stretched. Okay, and just holding this will help stretch it. But this first part of getting it moving may not feel real good.
Okay.
Kind of power through this stiffness.
We can do that.
Sound like a plan? All right.
That's really good news.
Yeah, great news.
Phew.
So am I going to be famous?
Yeah.
Going to go viral?
Of course.
So
Can you see?
check this out. This is really cool. So this right here is your knee joint. These black lines are your growth plates, and the cartilage around your knee is this stripe right here. So, you know, looks normal. There's no shift here.
Yeah.
ACL is here, and that looks good. PCL is here, and that looks good. She's got a little bit of fluid in the joint, not terrible. This is you laying on the table like they were in the MRI machine. So there's your knee, there's your kneecap. It glides in this groove, and that all looks perfectly lined up. The little ligament that holds it in place is here. It does not look torn, and that all looks great. Well, you did good. Your images were clean. You stayed still for the whole time.
Yay.
Well behaved. Some kids can't do that.
Yeah.
So.
You're very grown up.
Some grown-ups can't do it.
So guys, our appointment is over. Do you want to recap? What is the result of the MRI? You. Oh. Do you want to recap? What are the results of the MRI?
Yes. I don't have a fractured Nothing's fractured.
Yeah, so
But I have something in my kneecap.
he called it a clean MRI, meaning it didn't show any type of injury to her knee. There was a little bit of fluid, and so he believes there was something, like maybe the kneecap slid out of place and then slid back, and luckily nothing was torn during that, and so she does not need surgery. She is going to continue using the crutches and go to physical therapy because she has not used the leg for so long. It's weak. It's weak. I can't, there's a word for that and I can't think of it.
Like, it's so not tough. And then
Like her one leg that she's been using, the muscles are big and strong, and the other leg is just soft and squishy.
And I like
Squishy.
and soft.
She likes squishies.
And
But anyway, so we're going to do physical therapy.
guys, watch this. I can straighten my leg.
Wrong leg. So Sunshine's gonna do physical therapy. We had, let's see, come back tomorrow and we will show you all the exercises the doctor assigned for us because we're gonna be doing some homework on those. And then also stay tuned. We are gonna have an appointment with physical therapists. We'll let you watch that and see how that goes. And hopefully, through this process, Sunshine's gonna keep using the crutches to help her balance and practice using the leg. And hopefully she'll be done with those soon. But hope to see you guys tomorrow.
Peace.
Bye.
But not with your knee because it's gonna pop it.
Knee. Dab with your knee?
No,
I didn't even know that was a thing.
I said don't.
Yeah, but why would they? That's not a thing.
Yeah, they can dab with your feet. I do that.
Children.
I do that on the trampoline.
You do it on the trampoline? That is weird.
I go.
Bye.